Hi guys, this is Preeti and you're watching my discussion. In this video, I'll be teaching you about the atherosclerosis. First, the definition of atherosclerosis. It's a primarily progressive disease which is involving the tunica intima. You know, the vessel will be having three layers: tunica, intima, media, and externa or adventitia. In between tunica, intima, and media, there will be internal elastic lamina. And between the media and adventitia, there will be external elastic lamina. This is a progressive disease which is associated with the tunica intima, involving large sized arteries or medium sized arteries, muscular arteries. There will be focal lipid deposition. This for primary lesion is known as atheroma, so the name atherosclerosis. And then that will grows and forms plaques. This is the definition, that is, atherosclerosis is primarily a progressive disease of intima involving a large and medium sized elastic arteries and muscular arteries that is characterized by focal lipid rich intimal lesions called as atheromas or atheromatous or atherosclerotic plaque. This is the definition. Next subquestion will be risk factors. There are three types of risk factors which are modifiable, that means we can have control on that, and non-modifiable and additional risk factor. Modifiable you can remember as HSCD, C for cigarette smoking, D diabetes, H hyperlipidemia and hypertension. All these will be the risk factors for the atherosclerosis. And non-modifiable, coming from non-modifiable, all which you cannot control. So these are constitutional, that these are coming from the families, like familial history, or which will be having the genetic abnormality, or in age we cannot stop growing, we can't stop growing. So, and male will be the sex male will be having more risk towards atherosclerosis than females, which again it comes under cigarette smoking. Males are usually more smokers than females. And additional risk factors you can remember, like a person who drinks, he is having stress, so stressful lifestyle, and he drinks, so alcohol, then obesity, and then inadequate physical activities, raised procoagulant activity, and then CRP level, inflammation. All these are additional risk factors under atherosclerosis. You learned about modifiable, non-modifiable, and additional risk factors of atherosclerosis. Now coming for the next sub-question, etiopathogenesis. Etiopathogenesis I'll explain you through the diagram. I already told now, these are risk factors like hyperlipidemia, hypertension, smoking, homocystinemia, hemodynamics. These are the risk factors. This damage the endothelium, and so there will be endothelial dysfunction. This is a normal blood vessel. There is a tunica intima, media, and adventitia. This is the internal elastic lamina in between the tunica intima and tunica media, and the external elastic lamina between the tunica media and tunica adventitia. This is the endothelial cell layer. Endothelial cell layer. These risk factors will come and damages this endothelial cell layer. So there is a ineffective endothelial effect of endothelial injury. What will be there? All this cells will come: leukocytes, inflammatory cells, and addition to endotheliums, and increased vascular permeability, platelet addition, and then thrombus will be formed. So then there will be discontinuation of this endothelium. Then lipids comes here. So low density lipoprotein or LDL comes into this ring. Then migration of the monocytes, monocytes into the intimal wall, and lipid accumulation. Inflammatory mediators like macrophages and all will come and then engulf the LDL and then forms the foamy cells. These foamy cells may be the foamy cells of atherosclerosis are lipid laden, maybe smooth muscles or tissue macrophages or blood monocytes. You know, the blood monocytes only after coming into the tissues it becomes tissue macrophages. So these are foam cells. Foam cells is nothing but a lipid laden macrophages or tissue macrophages or blood monocytes. Blood monocytes will come into the tissues and become tissue macrophages, or smooth muscles also it may be. Then LDL or HDL, this bad cholesterol will be engulfed. Then there will be migration of smooth muscles also, will migrate, proliferate, and multiply, and then secrete extracellular matrix. Then smooth muscles may engulf oxidized LDL to form foam cells. These foam cells, the lipid accumulation in the intimal layer is known as atherosclerotic plaque, that will grow and becomes atherosclerotic plaque. Diagram I will explain you. This diagram I explain normal blood vessel, and then there will be monocytes and all lipoproteins will come. Monocytes becomes macrophages, and then they engulf the oxidized lipid to form a foam cells, and the smooth muscles from the media also will migrate and proliferate and multiply and secrete extracellular matrix. Then this macrophages engulf LDL to form lipid, and then finally the atheroma, which is at the level of the surface, becomes plaque, which is elevated. And other points which you need to remember here is LDL is a bad cholesterol and HDL is a good cholesterol, because bad cholesterol it takes the cholesterol from the liver to the peripheral tissue, whereas HDL is a good cholesterol. It brings the cholesterol from the peripheral tissue into the liver where it is metabolized. And atherosclerosis is having major risk factors are hyperlipidemia, all this modifiable risk factor: hyperlipidemia, hypertension, cigarette smoking, and diabetes. The word arthero means glue, artheroma, and hardening sclerosis is hardening. It's a primary disease of vessels involving tunica intima. Pathogenesis based on the injury hypothesis. This is the injury hypothesis. This is the pathogenesis. Next, coming for the next morphology, like next question, next sub question. Now we will learn about the pathologies, pathogenesis, risk factors, and definition. Next thing which you need to remember is site. You need to know the site where the atherosclerosis takes place. The site is this major vessels in, I told, major vessels and medium sized arteries and all. Major vessels will be lower abdominal aorta, like lower abdominal aorta, coronary arteries, popliteal arteries, internal carotid vessels, and circle of Willis. These are the sites where arteriosclerosis you can see. And site is over. Next, coming for the clinical significance of arteriosclerosis. These are the major clinical consequences of arteriosclerosis. There is a decreased blood supply to the brain. It causes a stroke. A decreased blood supply because of arteriosclerosis. There will be occlusion of the lumen. So there will be decreased blood supply to the brain. It causes stroke. Decreased blood supply to the heart. It causes myocardial infarction, and then because the wall will be weaker, internal elastic lamina and external elastic lamina, and injury to the tunica intima, it causes weakness of the blood vessels and causes aneurysm, so that swells out, and then decrease the blood supply to the terminal parts like terminal limbs. It causes gangrene, ischemic gangrene. And then after clinical significance, there are complications. After that, I will say morphology finally. These are the complications of arteriosclerosis. First, there will be plaque formation. This plaque may be weak. If it is containing less number of smooth muscles and collagen, it will be weak and it ruptures and forms ulceration or erosion. Then here the bleeding will be there. These are the acute complications. These three are acute complications: hemorrhage and hemorrhage into plaque, and then there will be formation. Endothelial. We were just tried there. Endothelial injury is also the factor for thrombus formation, so there will be thrombus formation, and then this thrombus will mobilize, dislodge and move, so that is arterioembolism. Then again because of weakness of wall, there may be aneurysm, and then finally it may heal by calcification, or if it is completely occluded, it causes stenosis. Stenosis is nothing but occlusion. This is a normal artery. This may be fibrofatty plaque or advanced plaque. This advanced plaque may be these are the consequences. These are acute consequences, and these are complications of chronic complications. This is all about the complications also. Now finally what we left is with the morphology. Morphology, whenever they ask you morphology, you need to write about the microscopic features and gross features, both you have to write. Microscopic features for both you see fatty streak and arteriomatous plaque. For both arteriomatous plaque and fatty streak, for both you need to write gross and microscopic. For fatty streak is the earliest lesion in the arteriosclerosis, and it is found in the children of 10 years. Gross, it will be yellow lesion 1 centimeter long, and it is mildly elevated. Length is 1 centimeter, mildly elevated, without disturbing the blood flow. This won't disturb, whereas plaque will disturb the blood flow. This microscopy lipid fold for foamy macrophages. I told foamy macrophages is how they are formed, because by the tissue macrophages engulfing lipid, or blood monocytes engulfing the lipid, or smooth muscles engulfing the lipids, forms foamy macrophages. And then now speaking about the atherosclerotic plaque, color will be yellow to white color, because that will be resolving. So plaque will be yellow to white color. This will be yellow color, and then the thrombus may be red to brown color, because it contains the red blood cells, fibrin, platelets and all. And then the size will be 1.3 to 1.5 centimeter. There 1 centimeter was there. In advanced lesion, the diameter increases. Shape is irregular, because plaque it may be irregular. It will be irregular distribution. It is focally distributed, and then it is having eccentric lesion. Composition, it will be very soft yellow color. In the core there will be lipid like cholesterol and cholesterol ester covered by the fibrous capsule. Like microscopy, it contains three components: C, E and L. CL like cell, you can remember cells which are like smooth muscles, macrophages and T cells. Extracellular matrix contains collagen, elastic fibers, and proteoglycans. Lipid, it contains both intracellular and extracellular lipids. The components of these regions are superficial fibrous capsule. The capsule is made up of smooth muscles and collagens, and then necrotic core which contains cholesterol and cholesterol esters. Then foamy macrophages, that is the cells on the components of cells, how they are distributed is this. And the shoulder region below the capsule, there will be the sides things which will be the hypercellular and contains more macrophages and T cells, that is called as shoulder. I'll explain all these things throughout the diagram again once again. This is a fibrous, this is atherosclerotic plaque. So this is a necrotic core, and then this is superficial fibrous capsule narrowing the lumen of the vessel, coronary artery. This is the artery which supplies the blood to the heart. This is the tunica media. Tunica intima has a big swollen, and then this is a superficial fibrous capsule. These are the regions, so the shoulder region. This lumen of the vessel is narrowed, normal blood vessel. Junction between the normal wall and the arteriomatous plaque, this is called as shoulder. Normal wall and the arteriomatous plaque is known as a shoulder, which will be having more cellular, like T cells and macrophages will be more in this region. This is the tunica media. And then cholesterol cleft, which contains cholesterol and cholesterol ester. This is all about the atherosclerosis. That means we learned about definition, risk factors, pathogenesis, etiopathogenesis, and the sites where you see, and significance, clinical significance, and clinical complications, and then finally morphology, which include Bronson microscopy. All this we learned in the atherosclerosis. Atherosclerosis is important for a 10-mark question. If you find this video helpful and it is quick revision for you, which you already studied, if you find this video helpful, please do like, share, and subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.